Okay, I'm sitting here with Dr. Nikko this afternoon, and we are talking about breast augmentation and placement. So, Dr. N, what are the placements for breast augmentations?
Okay, there's 3 different types of placement, and not to get too technical, but I need to get a little bit technical so that way everyone can understand some differences. The first and the most common placement is the submuscular placement. What does that mean? It's underneath the pectoralis major muscle. That's the big chest muscle. That's the major muscle that covers the top half of the implant. So when you hear the term submuscular, we're talking about going underneath that muscle. Now, I know some people are very educated. They'll come in and they'll ask me, well, is that dual plane? And does that, so what does dual plane mean?
Question.
Yeah.
So why would somebody go underneath the muscle?
Okay. So I would say 80% of patients have heard or talking to people or done their own research, heard that submuscular is better because submuscular does offer some advantages. The first one is that it covers the implant more. So technically there's less likelihood of rippling, although we're using silicone implants now. So rippling is still a little concern, but not a major concern, right?
Right.
But going underneath the muscle, there's less chance of capsular contracture. That's what we always try to avoid. And then also going underneath the muscle, most people feel it gives them a little bit more natural look. Now, how does that happen? Well, the muscle runs across the chest. It compresses the implant, so it covers the implant. So it doesn't give you that round, distinct implant look that a lot of people don't like. More natural.
Much more natural.
The disadvantage of going underneath the muscle is in terms of appearance is this. For people who are more barrel chest shaped, their breasts are kind of like going apart a little bit, and most people again want a little cleavage. When you're going underneath the muscle, the main disadvantage is that the muscle does kind of separate the implant a little bit more. So although it does look more natural because it doesn't have that round demarcation, it does kind of separate the implant. So for people who really want the cleavage to come closer together, it may be difficult. Secondly, for people who compete in bodybuilding contests.
Ooh,
obviously,
this is a lot of our patients actually. So.
Yeah, a lot of patients compete in fitness, Stephanie, but they're not really upstage flexing a lot and everything because when you're underneath the muscle, when you flex your chest, you expect some movement, right? Because when the muscle contracts, it's going to squeeze that implant. The implant can move a little bit. Now, we can actually control a little bit of that in terms of how much muscle we release down here. The more muscle we release, the less movement you'll get. And then the less muscle we release, then basically you're going to get more movement. The more, then you get less movement, but you get less support too. So bodybuilders.
So if you're active, so if you like to work out, if you're a runner, if you enjoy going to the Orange Theory or a lot of our patients, would you say that going under the muscle could be a better option for them?
Yes, of course.
So if you're active.
Yeah, so under the muscle, another advantage, you have the support. We don't release all the muscle down here, so you have a little bit more support, kind of like an internal support system for your implant. So when you're running, it's not really, your breast's not taking the brunt of the impact. So over time, tends to be a little bit less sagging. So that's another major advantage of going submuscular.
Okay, so
now,
again, that's under the muscle.
Yeah.
So what's the next one?
So why wouldn't everyone go under the muscle? Well, the main reason really is if you have, there's 2. 1, again, if you're a bodybuilder, and 2, if you really, really want the cleavage to come closer together because you have that shaped breast, chest that you need to go subglandular. Subglandular is the second placement. Now, subglandular means
above the muscle.
Above the muscle, underneath the breast tissue. Now, what's the situation where I would go subglandular? Well, for my patients, a lot of our patients are mothers. Or moms. They have, after 2-3 kids, you may have a little bit of sagging. So if you have a little bit of sagging and your nipple is slightly down than before.
That means like not pointing forward, so kind of having a little
drop.
Bit droppage.
Yeah, it drop
where
maybe.
your breast fold is.
Exactly. So if it's dropped down a little bit and you go submuscular, what's going to happen is that the muscle is going to hold up the implant where it needs to be. And then your nipple is going to be kind of below that, and your breast tissue is going to kind of fall over that a little bit. We call that the waterfall effect, kind of like the breast implant a little bit. So if you don't the only way that if you don't want to breast lift, then you would go subglandular, because the implant has to kind of fall down a little bit, fill that out, and make it look natural.
So what happens is then the nipple actually kind of points up just a little bit, so it's not falling down. And that's what Dr. Nikko explained with the waterfall effect. So.
Exactly. That's right. Thank you. And so when the implant falls down, then it will have that natural look. But those patients have to kind of understand you're not going to be able to go completely braless, because your implant will be a little bit down, and they have to be okay with that. A lot of patients are, because they're like, Dr. Nikko, I really don't want the scars from the lift yet. I'm not ready for that yet. And it's a perfect solution for that. Yeah.
So another thing too is you can always wear a bra after you have your breast augmentation and still give you that nice perky cleavage as well.
Yeah. So wearing a bra for cleavage. If I ask patients, so another question we ask, do you want to be able to go braless a lot? Some patients do, and if you do, then you can't really go above the muscle if your breast is already sagging a little bit, because it's going to be down here. If you want to go braless, you really have to go underneath the muscle and get that little breast lift. Perfect. But if you say, you know what, I don't really go braless, I don't normally wear a bra anyway, you can actually go above the muscle and skip that whole breast lift.
So why don't we talk about incisions then?
Okay.
So what about the incision point? So if you go above the muscle, where would you place the implant?
So either above the muscle or underneath the muscle, Stephanie. It really doesn't matter. There's 4 different incisions. There's really 3. One is right underneath, right above the fold. That's called the IMF incision, or right there, and that's the one that I would say 70% of surgeons do. It's actually, with study, it shows that that's to be the safest one. It has the least amount of complication. It's the easiest. We make that little incision.
It's very small. We use a Keller funnel, and it's about this large as well. So and it's under the breast fold, and you can rarely see it. Very
short, depending on the size of the implant, of course. But before, we would have to make the incision like a little bit longer to fit the implant. But now with the Keller, we can make it pretty small, fit the implant nicely in, and it blends in with your fold very nicely. That's the one I use most of the time. But I still have a lot of patients who don't want any scars on the breast, and we have a solution for that.
How do you do that?
So we can go transaxillary. We go underneath the arm. We can actually go submuscular, subglandular underneath the arms. I've done a lot of that. I used to do that a lot more, but now patients just find this to be easier and they're more comfortable with it. So we go both way. Some people, I go around the areola because it blends in with the areola. Some people say, well, I'm afraid I'm going to lose sensation. You don't lose sensation from going around the areola. That's a misconception, so don't even worry about that. Before, we go through the belly button, but no one does it anymore because you can't use silicone implants through the belly button. And I can't remember the last time I used saline implants. So those are the 3 choices.
So 4.
So you got underneath the arm, transaxillary. You got the IMF incision, inframammary fold incision, periareolar. Those are the 3. The transumbilical we don't really use because that's for saline implants only.
Gotcha. Saline implants only, which we rarely use. So.
Not anymore.
Yeah. Okay. Well, thanks, Dr. Nikko. That was very, very informative. So if you have any more questions, please call our office, 713-960-1311, or you can even go check out our website, www.drnikko.com, and we would love to have you come into our office for a personalized consultation with Dr. Nikko and I.
Fantastic.
Thank you.